First of all, I would like to thank EVG Network and my upline. I'm Cindy, your MC for this evening's webinar. I would like to thank all of you for taking time to join us this evening webinar. Before we begin, our AV team has muted all your Zoom apps, so allow the session to run smoothly without interruption. You can still continue to use the chat function within the Zoom apps throughout the whole webinar. We will have a Q&A sessions towards the end of the webinar. You can unmute to ask your questions or simply type your questions in the chat box. Yeah, you can see here, there is a chat box we can type here. So presentation slides and pictures will be displayed during the sharing. If you can't see it clearly, you may zoom in for a clearer view. Since the outbreak of COVID-19 in 2019, it has claimed that over 6 million lives globally. However, there is a silent killer that causes about 18 million deaths each year. Isn't that shocking? 18 million deaths annually compared to 6 million over the past 5 years of the pandemic. The silent killer is cardiovascular disease, more commonly known as heart disease. So, what is cardiovascular disease? What causes cardiovascular disease? Is heart disease easily to prevent? I'm pretty sure that we are here today and tonight because we want to learn more. This evening, we have invited our speaker, Daniel, to share insights on cardiovascular disease with us. Let's put our big hand. Welcome our speaker, Daniel.
Good evening, everyone. First of all, I would like to thank EV Global Network and my upline. I'm Daniel here. I'll be sharing on how to prevent cardiovascular disease. So in today's society, medical science is so advanced, but many people die from the diseases such as cancer, diabetes, and heart diseases. And according to the statistic by the World Health Organization, WHO, cardiovascular disease is the leading cause of death worldwide. An estimated of 18 million people die of cardiovascular disease every year, and it's projected that there will be more than 23 million people dying from a cardiovascular disease each year by 2030. So meaning that in every 3 people, there will be 1 dying from the heart disease. Hence, to keep the deadly cardiovascular disease at the bay, we should actively keep our health system healthy. So what is cardiovascular disease? Cardiovascular disease includes heart disease, stroke, heart failure, and arrhythmia, which is irregular heartbeat. So let's take a look at the causes of cardiovascular diseases. Arteriosclerosis, we have hypertension, high cholesterol, and high amounts of omega-6. That causes inflammation in our blood vessels and leading to the arteriosclerosis and increasing the risk of heart disease and stroke. And now let's take a look at how arteriosclerosis is formed. Arteriosclerosis is a disease in which the plaque build up inside the arteries. And plaque is made up of cholesterol, fat, calcium, and other substances in the blood. Hence, unhealthy blood cholesterol levels are the major risk factor for arteriosclerosis. So when bad cholesterol, which is our low-density lipoprotein, or we call it LDL, accumulate in our artery wall, the T cells are activated and attack the bad cholesterol, thereby causing the inflammation that leads to the arteriosclerosis. So to eradicate this problem, we should eat a balanced diet, control the cholesterol intake to stop the inflammation in the body. Hypertension. Another common cardiovascular disease will be hypertension, whereby blood pressure is a force of blood pushing against the wall of the artery as the heart pumps up the blood. Hypertension occurs when a constant excessive blood pressure on the artery walls. So when one blood pressure reading is higher than 140 to 90, it's known as high blood pressure. The bottom number is our diastolic pressure, and the top number is our systolic pressure. So what is the healthy blood pressure range? The normal blood pressure range is 120 to 80, where the diastolic pressure is less than 80 and the systolic pressure is less than 120. Hypertension causes T cells to accumulate in the kidneys, causing the kidney dysfunction and leading to the weakening or loss of kidney ability to excrete water and sodium. Hence, hypertension is often known as the silent killer. So when one has a hypertension, the doctor will also prescribe some antihypertensive medications. So have you thought of how antihypertensive drugs help to lower the blood pressure? First of all, is to reduce the blood volume. So some antihypertensive drug helps to decrease the amount of blood the heart pumps each minute. An example will be a water pipe. We have to turn down the faucet to have the water flow smaller. And relating back to our blood vessel, it means that the drugs only helps to lower the blood pressure, but the rubbish or the waste will still remain in our blood vessels. Hence, the drug does not solve the root cause. Another type of antihypertensive medications help to promote urination, which are diuretics. So diuretics inhibit the renal tubular reabsorption of water and sodium to increase the excretions of water and sodium. And this leads to the dilation of the blood vessel and lowering the blood pressure. The third type of antihypertensive medications will dilate our arteries by relaxing our vascular smooth muscle in the arteries and the veins. And these temporarily control the hypertension and reduce its symptoms. Have you heard that taking antihypertensive drugs can help to solve hypertension? I'm sure that there's no. Doctors will advise patients to consume these medications for a lifetime. Why is that so? If you stop taking, the blood pressure will spike up, as this drug can only help to alleviate the symptoms but cannot treat the root cause. And now let's take a look at the side effect of these drugs. So when taking these drugs, we have to be extra careful and follow the doctor instructions on how to take this medication. These are some of the common medication prescribed for high blood pressure. For example, lisinopril, which is helped to prevent blood vessel contraction, but it can cause the persistent coughing, kidney problem, dizziness, and rashes. Digoxin, which will increase the force of heart attractions, slow the irregular heartbeats, but the side effects are irregular heartbeats, loss of appetite, nausea, impaired kidney function. Warfarin sodium, which is a blood thinner, that has side effect as well, nosebleed, gum bleeding, and easy bruising. Spironolactone, which is a diuretic, that have a side effect that causes a poor kidney function and a low blood pressure. This medication can only control the symptoms, but it cannot help to improve the flexibility of a blood vessel wall. Hence, drugs alleviate symptoms but cannot treat the root cause. So if you want to improve our cardiovascular health or our heart health, we have to understand the causes of a heart disease. In fact, many diseases are due to what we eat. So what do many of us like to eat? So many of us prefer to eat meat, seafood in our daily diet. And according to the American Heart Association, the recommended daily cholesterol intake should not exceed 300 milligrams a day. So let's take a look at some of the cholesterol that commonly found in our food that we can choose so that we can choose our food wisely. Meat or animal innards. So pig brains contain 2,530 milligrams of cholesterol. Cow's brain equally high as well, 2,054 milligrams of cholesterol. The pig's kidney, 480 milligrams. Cow's kidney, 387 milligrams of cholesterol. The pig liver, 368 milligrams. Sausage itself have 150 milligrams of cholesterol. Seafood, codfish, 40 milligrams. Prawn, 170 milligrams cholesterol. Lobster, 85. Salmon, 86. Crab, 100 milligrams. Cuttlefish and a fat squid, 248 milligrams. So some say that they don't eat meat or seafood, but they like to consume eggs and dairy products. Let's take a look at the cholesterol in our dairy products. whereby we have egg yolk 266 milligram, a dark egg yolk 690 milligram, pure egg yolk 74 milligram. I'm sure we'll usually eat a few like 4 or 5 at once. This will definitely exceed the recommended amount. So 101 grams of scrambled egg has 435 milligrams of cholesterol, 100 grams of cream which contain 140 milligrams of cholesterol, and there are 100 milligrams of cholesterol in cheese. So ice cream, yes, ice cream itself also has cholesterol. So every 100 grams of ice cream contains 45 milligrams of cholesterol. 100 grams of milk has 30 milligrams of cholesterol. What about cholesterol that in our oil? 100 grams of chicken lard contains 74 milligrams of cholesterol. So have you tried those pork lard rice or use lard to stir fry or barbecue? Isn't it very fragrant? But lard itself has 56 milligrams of cholesterol. 100 grams of butter has 260 milligrams of cholesterol. And if you notice that vegetable oil has 0 milligrams of cholesterol. So although vegetables oil does not have a cholesterol, it's a major cause of cardiovascular disease. Let's take a look at the fast food. Do you like to eat Western food like hamburger and fry? A small burger itself has 30 milligrams of cholesterol. A large double cheeseburger has 80 milligrams. Fish fillet burger 40 milligrams of cholesterol. And a small cup of strawberry milkshake, it's only 178 grams, has 25 milligrams of cholesterol. So from here, we see that our diet can easily exceed the cholesterol intake daily, which is 300 milligrams. Hence, we should choose more healthy and low cholesterol food, which can reduce the risk of heart disease. So why do vegans even avoiding dairy products and egg, but they have a high cholesterol? Shouldn't they have no cholesterol at all? So where does cholesterol come from? Actually, 25% of the cholesterol come from the food that we eat. 75% of the cholesterol is actually produced by the liver. That's why, despite being a vegan, the cholesterol level can still be high. And why does our liver produce cholesterol? Let's learn more about our liver. Our liver produces 75% of the cholesterol in the body. And let's take a look at why our liver is one of the most important organs. Our liver is the largest gland in our body and it has 500 different functions. The main functions of the livers are detox, filter, and cleanse blood. So if our liver malfunctions, it can lead to a dull skin, spots started to show up on our skin. Liver helps to make bile. Some people which may suffer from digestion problem, this may be related to the malfunctioning of the liver as well. Liver helps to burn fat, which is our major fat burning organ. So if you wish to have a slimming or weight loss result, we need to make sure our liver is healthy. Liver helps to regulate blood sugar level. So if our quality of sleep is not ideal, it can affect our liver, which in turn result in an unstable blood sugar level. So it helps to release of energy. So have you noticed that some people always feel tired despite getting enough rest? This is because our liver stores carbohydrates for energy purpose. Hence, when our liver is damaged or it's not able to store the carbohydrates, then we must take extra care for those with such symptoms. Liver helps to synthesize hormone. So when our liver is malfunctioning, it cannot produce the needed hormones for our body function. For example, androgen and estrogen, which will lead to endocrine disorder, especially in a modern society. And many people are prone to more tense and stress, and many hormonal imbalance are linked to our liver health. And liver helps to make cholesterol. From here, we can see that many health problems are related to the liver, but why does liver need to make cholesterol? I used to think that cholesterol is a bad thing because high cholesterol is one of the major causes of cardiovascular disease, and high cholesterol requires long-term medication. But in actual fact, we need cholesterol. Without it, we can't live. Early on, I mentioned that 75% of cholesterol is produced by the liver, and cholesterol is one of the most essential substances for the human body. First of all, we need cholesterol to form the cell membranes. And let's take a look at the picture on the right. The smallest unit of our cell is our DNA. and every cell in the body contains the cell membrane. So cholesterol plays a vital role in forming the cell membrane. In addition, cholesterol is also vital for the synthesis of hormones in our body. For example, the body secretes androgens and estrogen, which we need. It needs to have sufficient cholesterol. So if the liver is not healthy, it may cause our endocrine system to become imbalanced. Have you heard that sunlight has vitamin D? In fact, there's no vitamin D from our sunlight. Our body will synthesize the sunlight we are exposed to and the cholesterol in our body into vitamins. Therefore, cholesterol is an important element in the synthesis of the vitamin D. However, we must take note that when our liver produces too much cholesterol, the body total cholesterol level will be high, which will increase the risk of heart disease and a stroke. So every time we go for a medical examination, a blood test report contains this cholesterol level, and one is the LDL, another one is called the HDL, which is a good cholesterol. In fact, Dr. Chen did say that our body does not have the so-called two types of cholesterol, a good and a bad. So when the liver produces cholesterol, it will actually transport the cholesterol to the cell that it needs of the body. It's called the low-density lipoprotein cholesterol, which is LDL. So it's just like a cellular calling out who needs a cholesterol. That's when the cell membranes and hormones will take in the cholesterol. When there is excessive of LDL, which is bad cholesterol, it will be directly deposited into our blood vessel, forming the plaque. If it accumulates over the time, it will cause the arteriosclerosis and causing the severe blood vessel blockage and leading to stroke and heart attack. So the higher the LDL, the worse it is for the body, which is why we call it bad cholesterol. So if our liver is healthy, we will produce and ensure enough high-density lipoprotein, which is called a good cholesterol, HDL. Its function is to collect the LDL in the blood back to the liver where it's broken down, and it removes the cholesterol from the artery wall, prevent the arteriosclerosis, and reduce the risk of heart disease. So I mentioned our diet earlier on, which will not only affect our cholesterol, but also our liver. So if the liver is unhealthy, we will produce too much cholesterol. So the health of the liver directly affects the functioning of the heart. So when the liver is unhealthy, it will produce too much cholesterol, resulting in arteriosclerosis. This in turn affects the heart function. Moreover, liver does not have any nerve ending. So we must take good care of the liver. Earlier on, I have mentioned that vegetable oil does not contain any cholesterol, but in fact, vegetable oils has adverse impact on our health. So why do we talk about oil, the cooking oil? In fact, the fats is a basic nutrient required by the body, where it's divided into omega-6 and omega-3. So the Vegetarian Society of the United UK recommend the omega-6 is to omega-3 ratio, the best is 3:1 in one's diet. So high amount of omega-3 will help to reduce the risk of cardiovascular disease, whereas high amount of omega-6 will cause inflammation in our body and increase the risk of a heart disease and stroke. However, modern diet contains too much omega-6 and too little omega-3. The typical American diet tends to contain 14 to 25 times more omega-6 than omega-3. So do we usually cook our meals or we eat out or take away? If the latter, then it's difficult to control the choice of the oils being used. And nowadays, people like to eat fried foods. Hence, the ideal ratio of omega-6 to omega-3 fatty acid in the daily diet should be 1:1 or 4:1. So now let's take a look at what type of oil people use at home. Does anyone use consume grapeseed oil? So many people have heard that grapes contain this OPC, which is very rich in antioxidant. But when it comes to grapeseed oil, it's no longer good for the body. The ratio for the omega-6 to omega-3 is very high, which is 676 omega-6 is to 1. This is very, very high. And cottonseed oil, 259 is to 1, which is also very high. So sesame oil is very essential during the confinement. And after confinement, the whole body can aging as the omega-6 content is very high, causing the inflammation. Sesame oil, 137 omega-6 is to 1 omega-3. Corn oil, 46 is to 1. Palm oil, 46 is to 1. So is it common for people to use sunflower oil for cooking? Sunflower oil, 39 is to 1. So in this table, there's peanut oil, which 32 is to 0. Tea seed oil, 32 is to 1. And many people use olive oil. And let's take a look. The ratio is 13 is to 1. It's also quite high. Soybean oil, 7.1. Canola oil, 2.1. Macadamia oil, 1 is to 1. Perilla seed oil, 1 is to 4. Kiwi seed oil, 1 is to 4. So now we know that oil we consume every day increase the risk of cardiovascular disease. It's no wonder that cardiovascular disease is the #1 killer. In addition to the causes of cardiovascular disease that I mentioned earlier on, for example, arteriosclerosis, hypertension, high cholesterol, and excessive omega-6 fatty acid. So what are the other factors that can cause cardiovascular disease? The factor includes malfunctioning of the immune system, aging, where the blood vessels lose their elasticity and flexibility, unhealthy lifestyle, alcohol drinking, smoking, emotion, stay up late, and unhealthy dietary habits, which is the lack of vegetables and fruits. Such unhealthy dietary habits in the long run is one of the causes of obesity and leading to cardiovascular disease. Besides adjusting our lifestyle, what nutrient can we take to prevent the cardiovascular disease, which is the #1 killer? So let me share some superfood that can boost up our immune system. First of all, we have blueberries, which is a very high antioxidant activity that can help to reduce the buildup of LDL, the bad cholesterol, prevent the formation of blood clot, lessen the burden of liver, lower down blood pressure, and prevent cardiovascular disease and a stroke. And next, we have hawthorn. Hawthorn that keep cholesterol in check, protect against arteriosclerosis, maintain the smooth blood flow by dilating a blood vessel, regulating the blood pressure, and improve the heart function, and prevent the lack of oxygen in the heart tissue. We call it hypoxia. And my another favorite food is oriental raisin tree or Hawaiian duck seeds that help to nourish our liver cell to regenerate, strengthen our liver function, lower the blood pressure and blood lipids, and maintain our cardiovascular health. American ginseng, which helps to prevent the LDL oxidation, prevent arteriosclerosis, and promote liver regeneration, and inhibits the growth of cancer cells and balance out our immune system. Another superfood that my favorite, which is cactus, which is the king of plant that have excellent nutritional value. It contains more than 10,000 types of phytochemicals. It helps to anti-inflammatory and helps in the wound healing, prevent arteriosclerosis, and accelerate tissue regeneration. And it helps to lower down the cholesterol and the triglycerides and reduce the LDL in the body and promote cardiovascular health. Rose helps to fight free radicals, delay aging, enhance the collagen production to improve the elasticity and prevent the rupture of a blood vessel. It also helps to improve the blood circulation. And next is our cordyceps mycelium. Cordyceps mycelium helps to prevent arteriosclerosis, stroke and heart disease, strengthen our heart, liver, and kidney, raise the good cholesterol, and reduce the LDL. So clinical research 273 took twice daily. After 8 weeks of patient enjoying an average 17% decrease in cholesterol level. So clinical trials are done by Guangzhou Medical College. And 38 elderly patients took daily for 3 months cordyceps mycelium. 20 out of 24 patients who had a supraventricular arrhythmia performed regular heartbeat exhibited signs of recovery. So far, I've spoken about superfood to nourish the liver and to avoid the food overproduction of cholesterol and clear the cholesterol in the blood vessel. You may think that it can reduce the risk of disease and stroke. So there's one more place to check, which is our gastrointestinal tract. What should we do? Earlier on, I mentioned that there are a lot of foods that contain cholesterol, and it's possible to avoid them, as everyone still wants to eat some eggs or meat. So what can we do? We can consume plant food that are rich in a phytosterol, as it can speed up the excretion of cholesterol from the body. So the one in the pink is our intestines, and the yellow one is our cholesterol, which consumed from our food. After eating, the cholesterol will be in our intestine, where it will be absorbed into the bloodstream. So what happens when we consume phytosterol? Phytosterol will compete with our cholesterol to be incorporated into mixed micelle, which is in green. And phytosterol have a greater affinity for micelle than cholesterol, and causing cholesterol to be excluded from the absorption process. However, unable to be absorbed by the body, cholesterol will be in the free form. In this way, phytosterol speed up excretion of cholesterol from the body. Research also shows that consuming 2.2 grams of phytosterol can reduce the cholesterol absorption of 60% in a day. And let us take a look at the plant food that are rich in phytosterol. Soy, yes. 1 gram of soybean contains 0.843 milligrams of phytosterol, which has the effect of lowering the blood pressure. Consuming phytosterol can reduce the cholesterol content in the body by 10% and the LDL content by 15%. So research shows that consuming 1.5 to 1.8 grams of phytosterol a day can reduce the cholesterol absorption up to 30 to 40%, while an intake of 2 grams of phytosterol can reduce the cholesterol absorption by 60%. So from this data, you realize that it's difficult to rely on the phytosterol to prevent the absorption of fat. From this data, you realize that it's difficult to rely on the phytosterol to prevent the absorption of cholesterol. But why do we need to monitor about soy? Because many people drink milk, take eggs, meat for product. However, they also contain the fat, cholesterol, cancer-causing hormone, and the other hands. But why do we need to mention about soy? Because many people drink milk, take eggs or milk or meat for protein. However, they also contain fat, cholesterol, cancer-causing hormone on the other hand. So soy is cholesterol-free. And its protein is 2 times the milk, 3 times the egg, and 12 times the milk. So soy helps to lower down the LDL and raise the HDL, which is a good cholesterol. So it's recommended to consume soy for protein instead, and it can prevent the risk of cardiovascular disease. The other plant food that rich in phytosterol is dietary fibers. So besides, it can help to lose weight and prevent constipation. It can also help to lower down the cholesterol. There are 2 types of fiber. We call it insoluble fiber and soluble fiber. Insoluble fiber acts as a natural cleanser, just like a broom, where it helps to excrete the toxin from the intestine, keeping the intestine clean. Soluble fiber protect the intestine with a protective layer, so it can prevent the absorption of cholesterol, thus reducing the risk of cardiovascular disease. So which plant is rich in fiber? The answer is psyllium husk. Yes. So 71 grams of soluble fiber in 100 milligrams of psyllium husk that helps to prevent the body from absorbing the cholesterol and fat in the diet, thereby helping us to reduce the blood cholesterol and lower the risk of heart disease. And last but not least, black goji berry, which is a king of anthocyanin that have powerful anti-inflammatory effect. Black goji berry aren't just tasty, they are loaded with anthocyanin, the compound that gives them rich dark color. The anthocyanins are powerful when it comes to fight inflammation and amazing for prevent fatty liver disease, reduce the heart disease, like those BP, triglyceride, and total cholesterol level. So if you want to live a healthy and a long life, we must prevent the world #1 killer, which is a cardiovascular disease. As long as we can prevent the cardiovascular disease, we can live at least 100 years old. How do we do it? First of all, practice the way to health and longevity. to have a healthy boy and have to start from an early age. First, you must have sufficient rest and sleep, at least 6 to 8 hours a day. And next, we must have a moderate exercise. It helps to strengthen our heart and liver, prevent the coronary heart disease, increase the flexibility of body and joint, enhance vitality, and help promote lymphatic circulation. Stay positive and happy. When we are unhappy and feel stressed, our body will secrete corticosteroid, which will suppress the immune system. Together with balanced nutrition by eating more vegetables and less meat. So I hope that through my sharing today, we'll work together to stay away from this world number one killer, which is a cardiovascular disease, or commonly known as heart disease. For friends who are currently taking medication for their cardiovascular condition, do practice these 4 ways to health and longevity. In the near future, I'm sure that the medication can be reduced or even stopped with the doctor's advice. So I wish everyone good health, good night, and stay safe. Thank you.
Thank you, Daniel, for your wonderful sharing. From his sharing, we have learned that we can't just depend on medication, as it often comes with significant side effects. Medications can help control the symptoms, but they don't really do anything to improve flexibility of our blood vessels. We also need to take care of our liver, since liver's health has direct impact on how well the heart functions. When the liver isn't healthy, it can produce too much cholesterol, which can lead to atherosclerosis and put extra strain on our heart. Poor dietary habits, especially lacking fruits and vegetables, can lead to obesity and increase the risk of heart disease over time. Besides adjusting our lifestyle, we should also choose healthier, low cholesterol food and high fiber diet to help reduce the risk of cardiovascular disease. So, has anyone actually benefited from consuming nutritional immunology foods to win back their health? If definitely a yes. And tonight, we have a testimony shared from Charlie. He will share with us about his friend's father who came down with stroke and paralyzed half his body. Let us listen to his friend's father's story of how he walked the path of recovery. Before we invite him to share a testimony, I would like to see everyone cooperation by not taking any photo during the testimonial sharing. And now let's welcome Charlie.
Good evening, ladies and gentlemen. My name is Charlie. I'm here to share my friend Singi father's testimony. My friend, after learning about nutritional immunology, knows the importance of nourishing health with proper nutrition. At the same time, she witnessed her father constantly feeling fatigue and having lots of work-related frustration. She understands that this could be signs of a major health threat. So she encouraged her father to also nourish his health with nutritional immunology superfood. Her father agreed, but said that this can actually wait after Chinese New Year. Then, just 3 days before Chinese New Year, she received a call saying that her father was admitted to hospital due to stroke, half body paralyzed and in coma. This was his second time having stroke, and this time around his condition was critical. Upon learning this, she immediately gave her father cactus, American ginseng, cactus fruit, acelora cherry, cranberry, rose, cordyceps mycelium, maitake mushroom, shiitake mushroom, avian mushroom, blueberries, and also a variety of superfood in beverage form. Then on the second day, he managed to regain consciousness and his energy level was looking much better than before. He's also able to move his hands slightly and speak a few words. Thinking that he can be discharged and can spend his time at home during Chinese New Year, he consulted the doctor, but doctor stated that he must be able to pass bowel movement before he can be discharged. So the doctor gave him a laxative injection, and after forcing a bowel movement, his entire strength plummeted and even needed 6 nurses just to support him. My friend continued to provide her father with those superfood as mentioned earlier. Now, let's see what happens after. As you can see from the picture, on the 3rd day, this is when his entire strength plummeted. Then this is on the 4th day, he's able to stand for a short while. Then on the 7th day, he's able to walk few steps without any walking aid. Then on the 17th day, he's even able to use the stairs going up and down. And in this pic, you can see, right, in less than a month's time, he's able to walk from using walking aid to without any walking aid. And he's looking so fantastic and healthy now. So as the saying goes, prevention is always better than cure. And the truth is, prevention is the real cure. So start your prevention journey now. Now with this, I end my sharing. Thank you.
All right, thanks, Charlie, for your sharing. Wow, amazing. Within a half a month, there's a recovery back. Just to follow up, earlier you mentioned that your friend's father regained his health by taking some plant-based food, right? Could you share with us how we can get access the ingredients you talked about in your testimony?
And thank you for asking. Okay, those so where can you find those superfood? And as mentioned earlier, it can be all found in Elite products. Okay, let me show you a picture. So earlier, what I mentioned, okay, the thing that he took was this complete nourishment series as shown in the products. And how he actually take it was he took 30 ml of Rhapsody, 30 ml of Rosy Time, 3 sachet of Immunity, and the rest of the products for replacement of his 3 meals. So basically, these are the things that he ate on his path to recovery. So I hope with this, it can help you to understand better. Thank you.
Thanks once again for Charlie sharing. I'm really happy for Charlie's friend's father regaining health through Elite Products Complete Nourishment Series. Prevention is always better than cure. Through nutritional immunology foods and making lifestyle adjustments, Charlie's friend's father was able to regain his health. By giving our immune system the right nutrients, we enable the repair and renewal of our cells. This helps our organs function at their best since the immune system is the best doctor itself. Let us congrats Charlie's friend's father again to gain back his health. Please take note that there's a disclaimer here. Elite products are plant-based foods which are very beneficial for health maintenance. However, Elite does not advocate any form of self-diagnosis or medical treatment. If you have any medical condition, please seek professional medical help. So next is our Q&A sessions. After the insightful presentations, I'm sure many of you have questions. Feel free to unmute and ask your question or type into the chat box. Let me see the chat box. Oh, today the chat box is very lively today. Yeah, I can see a lot of friends very enjoying sharing about their thoughts regarding the cardiovascular disease. Okay, I can see here. Is it true that fish oil, cod liver oil, promotes heart health and reduces inflammations? That coconut oil is a healthy cooking oil? Thank you for bringing up this important topic. Do we have someone from the Q&A committee who can help to answer these questions?
Thank you, MC. I will be able to help to answer this question.
Thank you.
Good evening, everyone. I'm Cindy. This is a very good question, a topic that often causes confusion, dietary oils, and their impact on our health. Let me repeat the question again. Is it true that fish oil, cod liver oil promote heart health and reduces inflammation, and that coconut oil is a healthy cooking oil? Let's explore the science behind this claim, separate fact from fiction, and empower you to make informed choices for your well-being. The power of omega-3, why fish is a heart-healthy choice. Let's begin by looking at fish and its connection to heart health. Scientists have consistently found that including fish in your diet is beneficial. However, it's important to make a distinction. They emphasize eating fish itself, not necessarily relying on cod liver oil or other fish oil supplement as a primary strategy. The key here is omega-3 fatty acid. Fish, particularly fatty fish, are rich in this essential nutrient, and omega-3 have been shown to play a vital role in cardiovascular health. Omega-3 are a type of polar unsaturated fatty acid. They continue to reduce triglyceride lowering blood pressure and decreasing the risk of blood clotting. They also have anti-inflammation effects, which are beneficial for overall health. Our body can't efficiently produce omega-3 on their own, so we must obtain them through our diet. This is why including food sources that are rich in omega-3 in your meal is so important. Beyond fish, harnessing the power of plant-based omega-3. The good news is that fish isn't the only source of omega-3. Many plant-based foods also contain a type of omega-3 fatty acid called ALA in short. It stands for alpha-linolenic acid. Kiwi fruit seed is one example. It provides ALA contributing to your omega-3 intake. Other notable plant sources include chia seed and certain vegetable oil like macadamia oil and perilla seed oil. Choosing plant-based omega-3 sources offers several advantages. They are generally considered safe, are often lower in calories than some animal sources, and they don't carry the risk of marine pollutants that can sometimes be found in fish. Fish oil supplements, are they right for you? Let's take a closer look at fish oil and cod liver oil supplements and why experts often recommend whole fish over them. One factor is freshness. Fish oil are susceptible to oxidation, which can make them rancid and reduce their effectiveness. Proper storage is crucial, but quality can vary. Calorie content is another consideration. Some fish oil supplements can be relatively high in calories due to their oil content, which can be a concern for many people managing their weight. The most significant concern is the potential for pollutants. Fish, particularly larger predatory fish, can accumulate heavy metals like mercury and other toxins from contaminated ocean water. These pollutants can then be present in fish oil supplements. While some supplements undergo purification processes, it's essential to choose reputable brands that are tested for purity. Therefore, the overall recommendation is to prioritize obtaining omega-3 from plant-based sources such as kiwi fruit seed, chia seed that support heart health, reduces inflammation, and promote overall well-being. Coconut oil. Understanding the controversy plus making informed choices. Let's now turn our attention to coconut oil, which has been the subject of much debate. It's crucial to understand that coconut oil is very high in saturated fat. In fact, it has a higher percentage of saturated fat than butter or even lard. Saturated fat has been shown to raise LDL cholesterol level, often referred to as bad cholesterol, which increases the risk of heart disease. The American Heart Association strongly advises against excessive consumption of saturated fat, including those found in coconut oil. However, it's important to distinguish between coconut oil and their other coconut products. Coconut water, for example, is a very different story. It's low in saturated fat and cholesterol and can be a hydrating beverage in moderation. On the other hand, the coconut flesh is high in saturated fat, similar to the oil, and should be consumed sparingly. To manage fat intake within your overall dietary choices, prioritize a balanced diet with a strong emphasis on plant-based food. This food provides ample amount of polysaccharide, phytochemicals, and antioxidants, contributing to optimal health. With that, I'll conclude my sharing. I trust I have answered your question. Thank you, and back to you, MC.
Thank you so much for Cindy's answer. I hope Cindy's answer provided valuable insights, and I'm sure it will be helpful to our friends who asked the questions. Due to time constraints, we will end the Q&A session now. Now, I have some great news to share with everyone. It's about Elite Expedition Challenge incentive trip to Oman. The company has carefully organized an Oman travel challenge to explore a destination rich in history and natural beauty. Without further ado, let's invite every team to play the video for us. Thank you.